I, Dr. Ramkumar Srivastava, maxillofacial surgeon, will give you the information about the oral infection and systemic diseases, which is a bidirectional relationship. All we know previously that the oral infection, if it is present in the oral cavity, this may be due to some of the systemic diseases. But nowadays the concept has been changed that if any oral disease is present in the oral cavity, this may result into some of the systemic diseases such as the cardiovascular diseases, rheumatoid arthritis, and adverse pregnancy outcome. Previous findings are that if you carefully examine the oral cavity, this may reveal underlying systemic conditions, and which is important for the early diagnosis and treatment of the patient. The patient with pemphigus vulgaris, thrombocytopenia, or Cohen's disease, oral changes may be the first sign of the disease. Oral findings of anemia may include mucosal pallor, atrophic glossitis, and candidiasis. Oral ulcerations may be found in the patient with lupus erythematosus, pemphigus vulgaris, and Crohn's disease. Diffuse melanin pigmentation may be the early manifestation of the Addison's disease. So these are some of the oral manifestations which are present in the oral cavity because of some of the systemic diseases. Severe periodontal inflammation or bleeding should prompt investigation of the conditions such as diabetes mellitus, human immunodeficiency virus infections such as the HIV, thrombocytopenia, and leukemia. In patients with gastroesophageal reflux disease such as the bulimia or anorexia, the exposure to the tooth enamel, especially the lower mandibular teeth, will result into the erosion of the enamel. This is because of the regurgitation of the gastric content, which is mainly containing the acidic solution. You can see in this case of the acute necrotizing ulcerative gingivitis, there is an inflammation of the gingiva, and this is most commonly found in the AIDS patient. Kaposi sarcoma is one of the early disease or manifestation which may present in the oral cavity, and we may diagnose it that the patient is suffering from the AIDS. Oral thrush is also one of the findings in the AIDS patient. Gingivitis is also related with the diabetes. If this type of the gingivitis is present, then we suspect the patient is suffering from the diabetes. Dental erosion is present especially in the mandibular anterior teeth, and this is because of the bulimia or the constant regurgitation of the gastric content which is containing the acidic solution. In recent years, there has been interest in relationship between the oral health and the general health, and recent findings have strongly suggested that oral health may be indicative of systemic health. Clinicians should increase their knowledge of oral diseases, and dentists must strengthen their understanding of the general medicine. This is required due to the finding supporting the association between the oral diseases and the systemic conditions such as the cardiovascular disease, type 2 diabetes mellitus, rheumatoid arthritis, osteoporosis, and adverse pregnancy outcome. Oral infections are also recognized as a problem for individuals suffering from a range of chronic conditions such as the cancer, infection with human immunodeficiency virus and patient with ventilator associated pneumonia. That the mouth has become a potential source of infection and inflammation that contributes to the systemic diseases and overall health of the human being. We all know that oral cavity is flooded with the many numbers of the microorganisms. These are the Streptococcus viridans, the gram-negative bacilli, for example, Proteoli and Fusobacterium. So these are the different types of the microorganisms which are present in the oral cavity, and if there is any increase in the number of the microorganisms, this may result into some of the systemic diseases. The notion that a relationship between oral diseases and systemic diseases might exist goes back over a century. A British doctor in 1900, William Hunter, identified links between oral sepsis and diseases of the other organs of the body, and this was termed as the theory of focal infection. On clinical experience, cases were reported where the removal of infected teeth produced improvement in the general health of the patient. You can see in this case, this is a case of Ludwigana in which there is a involvement of the facial spaces, especially the mandibular spaces, and this will result into the deterioration of the overall health of the patient. This is a case of Ludwigana which may result into the necrotizing fasciitis if the care has not been taken. This is another case of canine space infection in which there is involvement of the canine teeth. You can see there is involvement of the canine teeth, and because of this there is a swelling and it affects the overall health of the patient. Linkage between periodontitis and systemic disease. There is an association between the periodontal and many other diseases and conditions which has been reported, including respiratory disease, chronic kidney diseases, rheumatoid arthritis, cognitive impairment, obesity, metabolic syndrome, and cancer. So by periodontitis, all of these systemic diseases can result, and if you are not carrying the periodontal health, this may result into some of the systemic diseases. You can see in this diagram, if periodontitis is present, this may result into the many systemic diseases. This is a finding in the United States that if gum diseases are present, this will affect the overall body health of the patient, and it may result into the osteoporosis, stroke, Alzheimer, cancer, respiratory disease, and heart diseases. All we know that the gums is attached to the tooth surface, and if there is a deepening of this attachment, which is known as the pocket, there is a increase in the number of the microorganisms which is present in the pocket, and this may go into the bloodstream, which may result into the some of the systemic disease. You can see in this photograph that if periodontitis is present and if any inflammation is present in the gums, this may result into the increase in the number of the microorganisms and which may go into the bloodstream. This is a severe case in which there is a generalized chronic periodontitis, and if this condition is present, there is a increase in the microorganism which may result in any of the systemic diseases. All we know that in this diagram that one is the clear normal blood flow to the cardiac artery, and in the second diagram there is a atherosclerotic plaque formation. This is because of the infection which may be present in the arteries and may result into the cardiovascular disease. There are two mechanisms by which the cardiovascular disease can result. One is the direct one, in which the bacteria directly enter into the bloodstream and it may result into the cardiovascular disease. In the indirect pathway, bacterial toxins or pro-inflammatory cytokinins disseminate in the bloodstream and goes into the liver and initiate the acute phase response, releasing CRP, fibrinogen, and amyloid A protein into the circulation. This results in an increase in cholesterol synthesis as a disruption in the lipid balance and may result into the cardiovascular disease. So these are the two mechanisms. In the first one, the bacteria directly goes into the liver, then it causes the arthrogenesis and may result into the atherosclerotic cardiovascular disease. In the second one, bacteremia has been developed, which may result into the arthrogenesis, and this may result into the atherosclerotic cardiovascular disease. So these are the two mechanisms by which the bacteria can result into the some of the cardiovascular disease. So these are the two mechanisms. One is the direct one and the second one is the indirect mechanism. It is now well recognized that inflammation itself is involved in the pathogenesis of many chronic illnesses such as cardiovascular disease, type 2 diabetes, and rheumatoid arthritis. Association of periodontal disease with systemic disease study shows that the presence of periodontitis result into some of the systemic disease, and if we find that if you are successfully treating periodontal disease has a positive effect in the reducing the sign and symptoms of a particular systemic disease and would also support a causative link. Periodontitis and diabetes, there is a bidirectional relationship between the periodontitis and the diabetes, and we know that consistent evidence has been found that severe periodontitis adversely affects glycemic control in both diabetic and non-diabetic patient. The biological relationship between periodontitis and diabetes relates back to the common theme of chronic infection. You can see in this diagram there is a bidirectional relationship. The diabetes can result into the periodontitis and periodontitis can result into the diabetes. Periodontitis and adverse pregnancy outcome. This is also one of the systemic disease which may result due to the periodontitis. The link between periodontitis and pregnancy outcome has emerged mainly due to the medical studies showing that inflammation plays an important role in pregnancy, especially toward the end of gestation. Maternal periodontitis represents a potential source of microorganisms that may enter circulation and directly or indirectly have potential to influence the health of the fetus and also the maternal health. You can see in this case pregnancy gingivitis is present. This may be due to the plaque formation and may result into the overall health of the patient. The main adverse pregnancy outcome that had been associated with periodontal disease include low birth weight, preterm birth, and pre-eclampsia. A recent review described the evidence for an association between the periodontitis and adverse outcome as moderate. This is a finding in the United States that if any gum disease is present, this may result into the breast cancer also. What are the conclusions which may draw with this topic is that further research is needed to be done to establish the association between the systemic diseases and the oral diseases, especially the periodontal diseases. And the following simple oral health procedures are required to control the oral infection and also the systemic disease. Proper brushing and flossing of the teeth is important for the oral health. Limiting other risk factors such as the smoking. Patients with diabetes should be told that they are of increased risk of periodontitis, and if they suffer from periodontitis disease, their glycemic control may be more difficult and they are at a higher risk of other complications such as cardiovascular disease and kidney disease. The message to the pregnant patient should be given for better periodontal health means better oral health and well-being. The well-established risk of pregnancy gingivitis related to the hormonal changes during pregnancy should be addressed by oral hygiene instruction. So the conclusion is that you should care the oral health of the oral cavity, otherwise this may result into some of the systemic disease. So this is the vice versa. If any systemic disease is present, this may result into some of the oral diseases, and if any oral disease is present, this may also result into some of the systemic diseases. Thank you.